Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And in this week's Ask Dr. Pane question, we have a viewer from Orlando, Florida. And Dr. Pane, the question goes, are they a good candidate for tummy tuck and breast revision? A little more into this. Looks like they're in their late 20s and had a baby about 4 years ago. They exercise regularly, but they want to get rid of their stretch marks and work on the stomach area. So they don't plan on having any more children soon. And she's just curious, what procedures would you recommend?
Yeah, so when I looked at these images, we got to break it into two parts. With the tummy tuck, that abdomen looks really good. But if she's questioning a tummy tuck, it's probably because there's a little bit of loose skin when she sits, and it'll hang over a little bit. The stretch marks were mild. Somebody like this, they have to trade off whether they want a scar to get the abdomen even flatter. Naturally, a tummy tuck can do that, but there is a scar that's going to be required, and her abdomen looks pretty good. That being said, if you want it as flat as possible, then yes, a tummy tuck is going to be reasonable here. It is also possible, depending on how the skin feels in person, to do liposuction, but keep in mind that's still going to leave you with some loose skin once things have healed, especially when sitting down. So here in abdominoplasty, perfectly reasonable, but she has to weigh off the scar against the fact that the abdomen already looks pretty good. So that's one of those things you just have to kind of see what you're interested in doing. As far as the breasts are concerned, the complaint is that they're going off to the side. Now, we don't have the pictures to show that. There's a couple of different things that can happen. If the breasts, when you lay flat, are going off to the side, with time, heavier implants, depending on someone's body style, will slide off toward the armpit. Other people will have the breasts, the implant sitting, in a reasonable position, but there's a space between them. That can often be due to just your own natural anatomy. So we have to kind of figure out exactly what's going on here, but it sounded like they're going off to the side. In that case, revision of this, and I wouldn't recommend doing this with just anyone unless the person is confident that they do it a lot and that they like doing it, because what needs to be done, the implants have to be taken out. If they've been present a while, sometimes you'll change into fresh implants. If it's only because of the position, then there's ways to fix the outside capsule so that the implants will come more toward the center. And again, that's something I do whenever it's even mildly required. And over time, I've gotten very comfortable with this procedure. But I can tell you, not a lot of people want to do it because it is trickier. So you need a consultation in person to see what is going on with the implants, and revision is possible. And with the tummy tuck, it is also a reasonable option if the scar trade-off is considered favorable by this person, because she already has a pretty good looking abdomen. So again, a little bit of a lengthy answer, but I think we've covered the basics on that. And I think the person is overall going to get a good result in the right hands, and they should do well.
Excellent, excellent. Thank you, Dr. Pane, for your answer. And if you have a question for the doctor, please visit our Facebook page, website, Instagram, or Twitter account. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.